Leukemia is a cancer of the white blood cells. Acute leukemia means that it progresses quickly and aggressively, and it usually requires immediate treatment. Acute leukemia is classified according to the type of the white blood cells affected. There's two main types of white blood cells, and these are lymphocytes, which fight viral infections, and the myeloid cells, which do different things, such as fighting bacterial infections and defending the body against parasites and preventing the spread of tissue damage. Researchers suggest that low vitamin D levels, mediated by low UVB exposure, may be responsible for many leukemia cases worldwide. You can get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3 to correct any deficiency. Vitamin C reduces the risk of leukemia, and it may also be beneficial as a chemotherapy for the blood cancer, according to two recent studies. Both studies examined how vitamin C affects the metabolism and the genetics of blood-forming or hemopoietic stem cells. Mutations in these cells can give rise to various blood cancers. A recently released study found that human and mouse hemopoietic stem cells absorb unusually large amounts of vitamin C. When the cells were depleted of vitamin C, they were more likely to turn into leukemia cells. The results indicate the importance of taking 100% of the recommended amount of ascorbate or vitamin C, especially for older people, said the senior study author, Sean Morrison, the director of the Children's Medical Center, the Research Institute at UT Southwestern. This study was published in the journal Nature. The other study found that high doses of vitamin C can cause leukemic cells to die, potentially making it a useful and safe chemotherapeutic agent. The study was led by scientists at NYU's Langone Health and was published in August 2017 in the journal Cell. For this purpose, an IV of vitamin C would be recommended, or the best oral form would be liposomal vitamin C, with a minimum starting dose of at least 10,000 milligrams per day. Since cellular antioxidant capacity is decreased in leukemia, administration of antioxidants like curcumin is highly beneficial. Curcumin promotes apoptosis in several cancer cell lines, and it enhances the anti-cancer effects of chemotherapy. Typical doses of curcumin range from 1,000 up to 5,000 milligrams per day. Due to curcumin's low bioavailability, its absorption can be enhanced with biopterin, which is a black pepper extract, or it can be taken with a fat, such as coconut oil, butter, ghee, or fish oil. A new study shows that leukemia actively undercuts the ability of normal cells to consume glucose, thus leaving more glucose available to feed on for its own growth. Cancer needs energy to drive its out-of-control growth. In order to help starve the cancer cells and allow time for other therapies to work, a sugar-free diet, such as a ketogenic diet, has been shown to be beneficial in temporarily stopping the progression of many cancers due to their reliance on sugar. Several small clinical studies found that coenzyme Q10 supplementation may have potential benefits in different cancer types, such as breast cancer, leukemia, lymphoma, melanoma, and liver cancer, by either reducing the levels of inflammatory cytokine markers in the blood, improving the quality of life, reducing treatment side effects such as cardiotoxicity, reducing recurrence, or improving survival rate. Hence, taking CoQ10 rich foods may possibly be beneficial for these cancer patients. The best form of CoQ10 is ubiquinol. Typical doses can range from 100 up to 400 milligrams per day. Resveratrol is found in small amounts in red wine. Preliminary results suggest that resveratrol also inhibits the viability of freshly isolated leukemia cells, especially pro-myelolytic leukemia cells. Because of its low in vivo toxicity, resveratrol deserves further investigation as a powerful anti-leukemia agent. Typical doses of resveratrol are from 500 to 1000 milligrams per day in the form of trans resveratrol. Quercetin caused pronounced apoptosis in P39 leukemia cells, followed by BCL2, BCLXL, MCL1 downregulation, and BAX upregulation, and mitochondrial translocation, triggering cytochrome C release and caspase activation. Quercetin also induced the expression of FASL protein. All of these can be beneficial for various types of cancer. Typical doses of quercetin are from 500 to 1000 milligrams per day. Quercetin also enhances the action of vitamin C and zinc. Low levels of zinc are often noted in acute lymphocytic leukemia. Therefore, zinc supplementation may also have benefits here. Zinc is required by the body for around 100 different enzymatic processes. Therefore, it is a very important nutrient. Vitamin B12 deficiency can cause extensive hemolytic alterations, such as pancytopenia, markitosis, hypersegmentation of neutrophils, and hypercellular bone marrow with blastic differentiation. These dysplastic changes can sometimes be so profound that they mimic myelodysplastic syndromes or even acute leukemia. A blood test for B12 can fail to detect a deficiency due to food now being fortified with folate, and folate's ability to give a false reading on the B12 blood test. If you're unable to get B12 injections, the next best form would be a sublingual methylcobalamin B12 supplement with a starting dose of 5,000 micrograms per day. Scientists have discovered that acute myeloid leukemia grows by taking advantage of the B6 vitamin to accelerate cell division. So researchers from Cold Spring Harbor Laboratory and Memorial Sloan Kettering Cancer Center suggest that they could halt the growth of this cancer by limiting its ability to manipulate the enzyme that pushes B6 to make the proteins essential for the cancer cell division. It's an approach to attacking cancer without harming healthy cells, which need the B6 vitamin in order to survive. The body naturally kills cancer cells on its own. This process is called apoptosis, and it occurs when proteins break down cellular components and activate enzymes that destroy a cell's DNA, making the cell effectively commit suicide. A healthy cell will go through this process and die after roughly 120 days, but for cancer patients, apoptosis can be triggered to kill off unhealthy cells on demand. Researchers are excited about the anti-cancer properties in the micronutrient ellagic acid. It's found naturally in lots of healthy foods like grapes, raspberries, strawberries, and walnuts. And new research highlights its apoptosis-inducing abilities. Scientists at Kyung-hee University in Seoul, South Korea, found that ellagic acid slows the growth of cancer cells, and it jumpstarts apoptosis when applied in high doses, but even in smaller doses, it can also start apoptosis within the body. Adgione, a garlic-derived compound, has recently been shown to inhibit the proliferation and to induce apoptosis of human leukemia cells, and to induce apoptosis in myoblasts. There's a high prevalence of chronic magnesium deficiency in T-cell lymphoblastic leukemia. Most individuals are deficient in magnesium, as magnesium is required by over 300 enzyme processes in the body. Supplementing with it can have many health benefits after a few months of use. You want to start to slowly increase your dose of magnesium in the form of magnesium bisglycinate until the common side effects, such as stomach discomfort or diarrhea, are noticed. Then you want to reduce the dose until you determine your maximum tolerable daily amount. Cat's claw. The herbs oxindole alkaloids are also active against several lines of leukemia cells. Cat's claw does appear to be effective in treating feline leukemia virus, and case reports on the effectiveness of cat's claw given to Peruvian children with leukemia are promising. Cat's claw also appears to repair damage caused by chemotherapy. Iodine deficiency may play an important role in leukemia. Certain roles of iodine in well-being and protection against infection, degenerative diseases, and cancer may not involve its action on specific organs and tissues, but instead such properties affecting every cell in the human body may depend on the iodine to iodide concentrations in biological fluids. The most non-toxic, bioidentical, safest form of iodine is called nascent iodine. Picogenol from pine bark induced differentiation and apoptosis in leukemia cells, and data suggests that picogenol could serve as a potent cancer chemopreventive and chemotherapeutic agent for human leukemia. Immune dysregulation, which is a hallmark of chronic lymphocytic leukemia, manifests itself in 3 autoimmune diseases: warm autoimmune hemolytic anemia, idiopathic thrombocytopenia, and pure red cell aplasia. You can check out my other video on natural ways to help to treat autoimmune disease for more information about these type of conditions and dietary and lifestyle changes you can make to help improve your condition. The human stress hormone cortisol has been identified as a key factor when the immune system fails to prevent leukemia taking hold. The herb holy basil, also known as tulsi, helps to balance cortisol levels. Also, the supplement phosphatidylserine, when dosed at 600 to 800 milligrams per day, has been shown to control cortisol levels. Household insecticides may increase the risk of childhood leukemia. This is suggested in French research in occupational and environmental medicine. You could check out my video on mercury fillings to learn about natural methods to improve detoxification in the body. Electric blankets have been linked to childhood leukemia and miscarriages because of the fact that electromagnetic fields created by them are able to penetrate up to 7 inches into the body. People who are exposed to fluorescent light at home or in the workplace can experience feelings of reduced alertness, which in turn can lead to feel more tired than usual. This is because the electromagnetic fields which are emitted from these lights cause red blood cells to clump together. Clock radios, which are electric, emit relatively high electromagnetic fields. so these should ideally not be placed at or near your bedside. Other electrical items which emit low levels of electromagnetic fields, like hair dryers, washing machines, refrigerators, electric shavers, and vacuum cleaners, basically anything which requires electricity to work, will emit a level of electromagnetic field around it. Soy has been linked to a myriad of health conditions, like infantile leukemia, various forms of cancer, type 1 diabetes, malnutrition, thyroid dysfunction, and even erectile dysfunction. Research has shown that babies who've been fed soy-based formulas were at higher risk for developing type 1 diabetes and thyroid disease later in life. Soy-based formulas also contain up to 1,000 times more aluminium than a non-soy-based formula. Soy contains a large amount of anti-nutrients, otherwise known as toxins. One of these is what is referred to as an enzyme inhibitor. Enzyme inhibitors block the action of enzymes which are required to digest proteins. Even cooking the soy at high temperatures doesn't break down these inhibitors. As a result, consuming soy and soy products can lead to a condition such as reduced protein digestion, excessive bloating, a deficiency of essential amino acids, abnormal thyroid function, a higher risk of breast cancer in women who've had ovaries removed, and abnormal blood clotting. Mineral deficiencies of calcium, magnesium, copper, and zinc have also been reported. Stimulating molecules overactivate the immune system and cause it to collapse, and we are, of course, interested in blocking this mechanism. It's now been shown that certain selenium compounds, which are naturally found, for example in garlic and broccoli, effectively block the special immunostimulatory molecule that plays a serious role for aggressive cancers such as melanoma, prostate cancer, and certain types of leukemia. The recommended dose of selenium is 200 micrograms per day. Apart from garlic and broccoli, one way to meet your requirements is by consuming 3 Brazil nuts per day. When it comes to body weight, every 5 kg per meter squared increase in your BMI has been linked to higher risks of cancers of the uterus, the gallbladder, the kidney, the cervix, the thyroid, leukemia, liver, colon, ovarian, and breast. Carrots have been found to have a good effect on leukemia. Carrots contain beneficial agents such as beta-carotene and polyacetylenes, which could be an effective treatment of leukemia. Ginseng is a well-known herb and is often used in combination with anti-cancer drugs to enhance the chemotherapy. Astaxanthin is one of the most powerful antioxidants available. A daily dose of 12 milligrams would require you to eat a full wild salmon in order to obtain it naturally. It's considered to be 6,000 times stronger an antioxidant than vitamin C. It's demonstrated a consistent ability to reduce multiple types of cancer in various trials.